Welcome to Health Talk. This is Friday Reports. I'm Dr. Gloria Wu. This is our weekly COVID-19 update. We have some interesting findings here in mid-July 2022. Now, 350 people are dying each day. The ICUs have increased its occupancy by 23%, and many people all around you are getting COVID. It's the BA.5 variant, which is extremely transmissible, and everyone's getting it. What to do, and what do we think about it? Well, we think that 2 out of 3 COVID infections now is because of the BA.5 variant. And what can we do about it when we are going outdoors? If you're outdoors and it's crowded, put on a mask. If you're indoors in a restaurant, put on a mask until you're ready to eat. Think about where you're going, because what happens is that if you keep getting COVID infection despite vaccination and you have repeated infections with this COVID Omicron variant, you're at risk for long COVID, which means that you can have chronic fatigue syndrome. And a lot of people, even after one bout of COVID, have 6 months of being short of breath, of a chronic little cough or a chronic bad cough that eventually gets better. And another thing to consider, if you get COVID and you have fever, you feel sick, you feel like it's the flu, go immediately to a drugstore, CVS, Walgreens, Rite Aid. They all can give you Paxlovid, Paxlovid. It's a Pfizer drug, and you have 5 days to get it for it to work. So this will really help you if you're one of these immunocompromised groups, if you have diabetes, high blood pressure, if you have some weight problem. The other thing to think about is that 110,000 new infections a day is occurring. We think this is way underreported because we think it's 7 times higher, because more people are getting home test kits and nobody's reporting this. So we're thinking about maybe 700,000 new infections a day. Many people are even asymptomatic. So you have 5 days to be asymptomatic and still give it to people. So you could be testing negative for 5 days. It's on the 5th day that you will test positive. So these are things to consider when you're thinking about jumping on an airplane. Wear a mask when nobody else is wearing one. If you're thinking about going to a great new restaurant and you're waiting in line, wear a mask. And think about social distancing as well. So here, we wear a double mask because I see patients, and you could even use a single mask, but wear some type of face covering like this. We don't want people to get it all the time, because what happens is the COVID variant will keep mutating. So there's something called the HA2.75. That means it's mutating the spike protein 7 times or 11 times the BA.5 variant. So if it keeps mutating, it'll evade our immune system and we won't be able to get rid of it. So not only tell your neighbors to get vaccinated, get the booster, but think about all the ways where if you're in a crowded space, think about how not to give it to yourself and to your loved ones. So think about a face mask. There's an N95, which protects 95% of the particles, or 2 surgical masks. So think about that. Something is better than nothing. So with this, enjoy the summer, but be aware of what's going on around you. And we don't want everyone to get long COVID. In ophthalmology, I see them with inability to focus, inability to read for more than 5 minutes. This lasts 6 months. Sometimes I see tiny little bleeds in the retina, the back of the eye. This also goes away in 6 months. Their vision is excellent, but they see that something is wrong. So we don't wish that on anybody. We want you to be healthy. So think about this. Be safe, be healthy, and try to enjoy yourself, but still think about being safe. Thank you so much.